Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you are taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwede sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako, ganun.
We're always with you from start to healing. Magandang araw po sa inyong lahat. Ako po si Ciela, ang inyong host, at narito po tayo muli sa Simply Nature Success Stories. Napakapalad po natin ngayong araw dahil napaunlakan po tayo ng isang lung cancer patient na may very inspiring story na ibabahagi po ngayong sa ating lahat. Magandang umaga po, Ma'am Violeta. Salamat po sa pagpapaunlak niyo sa amin ngayong araw na ito. Maaari niyo po bang ipakilala ang inyong sarili sa ating po mga manonood?
Okay. Sige, salamat sa inyo. Ako po si Violeta. Magsi-67 years na ako. Na-diagnose po ako nagkaroon ako ng lungs cancer na stage 3C. Halos stage 4 na daw yun. Ay, nung 2022, nag-ubo-ubo na ako pero gumaling. Tapos nung 2023, inuubo na naman ako. Hanggat sa ang plema ko is may dugo. Hindi ko yun sinabi sa mga anak ko. Nilihim ko yung gawa nga ng akala ko TV lang. Mga buwan ng May, sinabi ko sa kanila. Alam naman nila yun na ubo ako eh. Pero sabi ko, hindi na maganda. Ang sabi ko, may dugo na yung ko. May dugo na yung plema ko. Di pina-x-ray nila ako, mayroon ng findings na mayroon bukol ang lungs ko. Ang ginawa naman ng doktor, naman ako, CT scan with contrast. Yun nga, nakita mo, bukol sa sa lungs ko is malaki na. Hanggat sa napansin ko naman na mga buwan ng June o July, mayroon na akong nakapa dito mga bukol. Sa liig ko binayopsy. Hanggat sa dumating ang result ng biopsy after 2 weeks, hindi na maganda. Dahil nga mayroon akong lungs cancer, stage 3C. Ayaw ko kasi magpa-chemotherapy noon. Pero dito sa bahay, nagpakuha ako ng oxygen tank, malaki. Hindi na ako nakakakilos kasi noon eh. Halos nakahiga na lang ako, pupunta ng CR, pagbalik ko salpak agad ng oxygen. Dahil sa grabe na nga. Talagang ang isip ko, kung anong gamot ang makakalunas.
Kayo po ay gumamit ng Simply Nature PPARS. Ano po yung mga naramdaman yung kakaiba o pagbabago?
Nung dati pa man, bago ako binayopsy, na nagsisimple nature na ako siguro mahigit ng 1 buwan, Maganda dahil yung dugo ng plema ko nawala doon sa PPARS liquid. Nawala yung dugo. Hanggat sa ma-biopsy nga ako, mabigyan naman ako ng yung gamot ng biopsy, eh, magaan-gaan na magaan-gaan na ang pakiramdam ko kasi wala naman ng dugo.
Naisabay po ninyo itong Simply Nature PPARS dun sa GPT po, no, yung targeted therapy po, na nasabi ninyo kanina. So, nagkaroon po ng magandang improvement sa loob po ng isang buwan, tama po?
Mula nung mag-PPARS liquid ako, na mga nakakailang box ako, nawala yung dugo sa plema ko. Yun naman ang guminha-ginhawa ako. Hindi, ang pagdating ng result ng biopsy at naresetahan ako ng gefitinib, ang bilis lang. 4 na beses lang akong nakainom, nawala na yung ubo ko, nawala na yung plema ko.
Para po sa kaalaman ng lahat, ang isa po sa maganda sa Simply Nature PPARS is kapag po ito ay naisabay sa conventional treatment, kagaya po ng chemotherapy o kaya po prescription medicine po na pre-prescribe po ng mga oncologist, ay may pagkakataon na mas napapalakas po natin yung bisa or yung effectiveness po, no, ng mga gamot na ito at mga treatment na ito, lalo na kapag kasabay po ng PPARS. So, I think ganun po yung nangyari po sa inyo. No?
Kasi bago pa man ako na diagnose ng may lungs cancer ako, ayon doon sa biopsy, nainom na ako ng PPARS liquid saka PPARS ng tablet. Nawala yung plema ng dugo ko. May 1 buwan na rin. Ang ganda ng epekto sa akin. Ang sigla ko na, 1 buwan, 1 linggo, hindi na ako nahingal, hindi na ako nag-o-oxygen.
After po nun, so nagtuloy-tuloy po kayo ng gamit din po ng Simply Nature PPARS?
Hanggang ngayon, nag-Simply Nature pa rin naman ako for prevention na pampalakas din ng resistensya. Hanggang ngayon, nagiinom pa rin naman ako.
Pati po yung mga nodules o yung kulani po ninyo, no, o bukol sa leeg, ay nawala.
Nung nainom na ako nung gefitinib, yung mga bukol dito nagdamihan, ang dami po na talaga dito ng bukol. Awa ng Diyos. Unti-unti na rin yun, araw-araw, kada umaga, kinakapa ko, ang liig ko nawala. Pero tuloy-tuloy pa rin naman ng inom ko nung PPARS kasi yun nga ang nakakaganhawa sa akin. Pag nakakainom ako noon, medyo malakas, parang maginhawa bang huminga. Kahit may iniinom naman ako ng hindi na ako hindi na ako nag-oxygen. Kasi nga maginhawa na ang paghinga ko. Hindi naman sa wala akong tiwala sa mga chemotherapy, pero ang dami ko na kasing nakikita na mas lalong daming naaapektuhan ng chemotherapy. Kaya ang ayaw ko talaga ng chemo, hanggat maaari gusto ko na lang yung alternative medicine. Yun na nga, di naman din ako nagpabaya na binibilhan naman ako ng mga anak ko ng mga daming mga herbal. Pero ang naramdaman kong mabisa o maginhawa sa pakiramdam ko ang PPARS. Kaya yun ang tinuloy-tuloy ko. Basta ako mahigpit akong sinasabi ko sa kanila, ayaw ko ng opera. Ayaw ko din ng chemo. Kasi hindi ko kakayanin na yun. Mag-antay-antay tayo ng panahon kung i-effective itong kasi ang tinira ko na lang, hindi na ako nainom ng iba pang mga alternatives. Sabi ko, ito na lang, dahil ito ang nakakaginhawa sa akin, PPARS nga.
Last January, nagkaroon po kayo ng CT scan. Ano po yung dumabas niyo sa CT scan niyo netong January po?
Sa CT scan nitong January, ito lang 2024, is maayos na. Hindi na, wala na yung mga bukol. Kasi kahit si Doc Jansen naman noon, gusto niya na rin ako ma-CT scan para daw malaman, curious daw siya kung ano daw yung nangyayari na sa bukol ko. Maayos na, wala na yung mga bukol. Parang cavity na lang daw yung naiwan ng mga pinag-alisan ng bukol. Yun.
Dito po. So parang ito yung parang naging resulta po, no? Nung pag-combine po ninyo ng PPARS at saka po ng GPT po, no? This past months po. Ano po yung mensahe na pwede niyo po maibahagi sa kanila, sa mga katulad po ninyo na nasa kalagitnaan po ng cancer journey?
Laban lang. Huwag tayo mawala ng pag-asa. Ang cancer, nagagamot. May Simply Nature, may PPARS, maganda. Yun talaga ang naranasan ko na guminhawa talaga ako. Nung medyo inatake ako. Dahil yun ang maginhawa sa pakiramdam ko na. Pag inuubo ako, nakakaginhawa naman talaga.
Ma'am Violeta, maraming salamat po sa pagpapaunlak niyo sa amin at pagbibigay po ng panahon para maibahagi niyo po yung inyong inspiring story po sa ating mga kapwa-pasyente na nasa kalagitnaan o may pinagdadaanan din pong laban against cancer.
Ay, ako si Violeta, 67 years old. Na-diagnose po ako ng lungs cancer, stage 3C. Dati po, hirap ako sa paghinga, naubo, at ang plema ko lumalabas, maraming dugo. Talagang hindi ko na rin alam kung paano. Nung mag-take po ako ng Simply Nature's PPARS liquid at PPARS tablet, maginhawa po ang aking pakiramdam at nawala po ang dugo. At sa ngayon, hanggang ngayon, maayos na po ang pakiramdam ko. I trust Simply Nature. Maniwala po tayo.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's not enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you are taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwede sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing.
today with a Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS tablet for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Now is the best time to try our Simply Nature products. Available on our official Shopee, Lazada flagship store, our website www.simplynature.asia, and our office is BGC Taguig. Order yours today. Click the link on the description box.
Hey everyone, I'm Sheila and welcome to another enlightening episode of Simply Nature webinar. This program is brought to you by Simply Nature International and Simply Healed Medical Group. Just a recap on our last week's topic, we discussed achieving itch-free skin by targeting the root cause. Lots of questions were asked and most importantly, answered by our experts. This week, discover how breast cancer patients can benefit from using PPARS because tonight's interesting topic is entitled Breast Cancer, the Role of Supplementation. Tonight, we will discuss the major impact that various supplements can potentially have on the prevention, treatment, and management of breast cancer. From antioxidants to vitamins and minerals, understanding how these supplements interact with breast cancer cells and treatment modalities is crucial for optimizing the patient's outcomes. We extend our sincere gratitude to each and every one of you for tuning in to this webinar, and we encourage you to share this online event with your friends and loved ones who may benefit from the insights shared here tonight. So without further ado, let's dive right in. Please note that we will be having an Ask Me Anything portion later on, so please feel free to drop your questions on the comment section. Leading our discussions tonight are distinguished health experts. First off, I'd like to introduce a successful entrepreneur and seasoned international speaker on a wide range of topics from personal success to healthcare. He is the CEO and founding director of Simply Nature International and the PPARS expert from Singapore, all the way tonight from Taiwan, Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Sheila, and good evening to all our viewers, especially our regular viewers, right? I'm actually coming to you from Taichung, Taiwan. All right, I'm actually here to celebrate the birthday of my Ninang, who is also the wife of the founder of the PPAR protocols. So we had very lively discussions today, and we were talking about research that we were going to do in the coming 2 years regarding PPAR protocols. So tonight's topic is very timely. It's about major role of supplementation with breast cancer treatment. So stay tuned for the AMA, because I know for all the breast cancer patients or any cancer patients who are viewing this show tonight, one of the first questions you ask your oncologist or your doctor after being told that there is cancer is probably, Doc, what supplements are good for my medical condition, right? So we will actually answer that. And during the AMA segment of the Tonight Show, feel free to ask those specific questions again, right? Like, oh, Doc, should I take vitamin C? Doc, what about vitamin D? Doc, what about the foods that we should or should not eat? All these questions are very valid questions. And I'm quite sure that many times when we ask oncologists or our surgeons, the answer they give us is pretty generic because that's not their area of expertise. Well, that's why we have this program today. So enjoy the first discussion segment with Dr. Jansen. And after that, we'll actually go in and answer your specific questions about supplementation and breast cancer. Thank you. I'll hand the time back to Sheila as she introduces us to our main speaker tonight, Dr. Jansen.
Thank you, Sir Shyan. Okay, and now on to our next health expert. It is an honor to present our esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's Medical Center, College of Medicine. Dr. Jansen Kalalan is a diplomat of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Kalalan specializes in the treatment of cancer and metabolic illnesses. Please join me in welcoming Dr. Jansen Tan Kalalan. Let's all watch this.
Microalgae is actually considered as a superfood.
Yeah.
So it's a complete food. PPARS can actually preserve the bone marrow. One effect that I really like with PPARS is that it's a perfect chemotherapy, radiation therapy support. Do not be afraid of what the results might turn out to be. Because the results that turns out might be life-saving. You just have to take action. That is the first step. Okay? Do not forget to live your life as well. Okay? Enjoy the things that you have right now. Just have faith. It will come to pass.
All right, guys, welcome again to Simply Healed by Simply Nature. And today we have one of our favorite doctors and also one of our most popular doctors, the very capable and also very guapo, Dr. Jansen from 4Leaf Group. So once again, Dr. Jansen, we're so happy to have you on. Our viewers and our patients love you. You always get such a great response. So welcome back.
Hello, Shyan. Hello, everyone. Glad to be here.
Doc, before we even begin, do men get breast cancer as well?
Yes, very rarely though.
Oh, wow. Okay, so this applies to both men and women. So today our topic is going to be about breast cancer. Perhaps you can share your advice, what they can do to minimize their risk for breast cancer based on their age group. If they're young, they're middle aged and elderly, are there different things that they can do?
Well, of course, depending on age group, there are a lot of things that you can and cannot do. No, but in general, number one is nutrition.
I really wanted to say that it's quite difficult, honestly, to go totally plant-based. If there is a first target to aim for, because I read in one of the studies called the China study, they said that if your meat intake is when it crosses the 20% of your diet, the bad effects get worse dramatically. So
Yes.
so would it be okay? Would it be a good first step for most of our viewers, especially the young ones who are healthy? Perhaps a realistic target first is to make sure that on your plate only 20% is meat and the rest is plant-based. Would that be a good start?
Absolutely. Yes,
Great.
absolutely. That is a very good start. Because realistically speaking, our culture, the Filipino culture, is not really very, what you call this, plant-based friendly.
Yeah, it's
Yeah,
hard.
it's
to
not.
find, actually.
It's hard. Yeah, it's difficult to find unless you already have made the adjustment. Then it's easy for you to make the what you're already doing. No? But for people who still want to change, well, first one is it's a stepwise. It's not really a black and white thing. No? So you can actually lower your risk as the animal protein intake goes down.
After dietary, is exercise important?
Yes.
What kind of
Exercise is also equally important than with diet. No, with exercise you lower the risk for recurrence of cancer.
so exercise is important to prevent recurrence of cancer?
Yes.
Okay.
Yes. So 30 minutes a day of moderate intensity exercise that will do you a long way already. But of
Wow.
course, you should not stop with just 30 minutes. If you can increase it
Can go further.
if you can do more, then it would be much better. No, so as you age, of course, mobility decreases. Well, for elderly women, still walking is very important. Physical activity is important. If you can do brisk walking, then good. If you cannot do brisk walking, then go for light walks. When you suspect that you have breast cancer, no, that is when you during your bath, when you feel your breast, you feel some lumps, or there are some skin changes in your breast. Some skin changes are when there's dimpling of the skin, or there is a wound there that is not healing, or you have nipple discharge. So those are some signs, and of course when you feel your kilikili, okay, there are some lumps. So those are signs of breast cancer. When you feel those signs, or when you have those symptoms, you have to immediately go to a doctor, because breast cancer is really curable. it would be such a waste if you do nothing and then
Wow.
you later realize that, wait, I already have stage 4 breast cancer and it's too late, where in fact you already felt that lump years before and you did nothing.
So I know that from our normal daily diets, it's going to be hard to take in the lifestyle food that will protect us from chemo and to also strengthen our immune system. So what are the most important few vitamins and minerals and supplements that a patient needs if they have?
Okay. Okay, so number one is if you are going on a plant-based diet, no. So this means that you're not eating any animal food products already. Then vitamin B12 is very important. 50 micrograms once a day or 2,000 micrograms once a week. If you're already 65 years old and up, then take 1,000 micrograms a day. Okay,
Wow.
so that's number one, vitamin B12.
All right.
Then number two is, of course, sunlight is very important. But of course, when your lifestyle is really not out there in the open, you have less of a few sunlight exposure, then you can take vitamin D3. Vitamin D3, 2,000 international units once a day. That's already okay. And then some patients, when you are already diagnosed with cancer, no, you can also take vitamin C plus zinc. This is to boost your immune system or to keep your immune system at optimal levels, or one capsule twice a day. Yeah, after meals, no. And then the third one is PPARS. Actually, microalgae. Microalgae is actually considered as a superfood. It has already been studied by. Yeah, it's a complete food. It has a complete nutrient, so you won't miss anything. It also has omega-3s, and then its effect is primarily on the metabolism. So you metabolize fatty acids much faster or easier. So in that way, well, cancer, too much fatty acids kasi in our body produces oxidative stress as well. And it produces inflammation. Typically, patients with breast cancer are on the high or on the heavier weight category.
Oh, okay. More
they tend to have more fat inside their body. So this is one way to metabolize those fats. And then, of course, since PPARS or the microalgae is also a food, it has really very low in calories, but it gives you the proper nutrients that you need. It will also help you lose weight. But of course, you have to do your responsibility as well. One effect that I really like with PPARS is that it's a perfect chemotherapy, radiation therapy support. Because chemotherapy and radiation therapy, yes, it will obliterate cancer cells, whatever cancer cells in your body has, but it also obliterates the healthy cells, particularly the bone marrow. The bone marrow is where your immune cells are incubating. It is where they are maturing. So that when they mature, they get released into the blood. If you destroy that nursery, so to speak, you destroy your chance of developing soldiers. So yeah, your immune system. So PPARS can actually preserve the bone marrow.
Wow. So that sounds like that's the perfect way to go through your chemo so that there will be no reoccurrence. What a perfect combination, Dr. Jansen.
Yeah. It's really a good combination. Yeah.
Thank you for your illumination. Even I feel encouraged today, and I'm a guy. Dr. Jansen just shared so clearly that number one, there's so many women out there who get breast cancer every year. In fact, 30% of cancer by women in Philippines are breast cancer. So if you have it, you're not alone. The good thing about so many people having breast cancer is that the doctors have lots of experience with breast cancer. And so much experience has gone in that defeating breast cancer the first time, if you detect it early, is almost 100%. That's good news. I mean, if you're stage 1 breast cancer, you can be confident that you can be treated well. So our takeaway today is don't ignore any lumps, right? The moment you get lumps, don't be afraid. Don't be afraid, because if breast cancer is detected early, it is treatable. Hallelujah. You don't have to worry. Right? And look, our Dr. Jansen is so friendly, so knowledgeable. So if you or any of your loved ones has breast cancer or fear of breast cancer, do the steps, right? Get it tested. If it is breast cancer, again, don't worry. Dr. Jansen already said the treatment is going to be effective. Okay, get yourself a good oncologist like Dr. Jimmy, and who will definitely work very well with Dr. Jansen, and you will have a successful first fight and last fight because there won't be any reoccurrence. Right? If you follow Dr. Jansen, especially after your treatment, your chemotherapy and everything, you won't have a reoccurrence. All right. Any last words? Any advice, encouraging words, or words of assurance you want to tell our viewers out there who have or have a loved one with breast cancer?
Number one is don't panic. Just be composed. Yes. It will. It's normal to feel afraid, and it's okay. It's okay to feel bad. Okay, so it's a natural reaction. But do not panic. The next step that you have to do is go see a doctor. So you will be guided. The thing is that you have to take action. Do not be afraid of what the results might turn out to be. Because the results that turns out might be life-saving.
Wow, what a powerful...
Might be life-saving because I have a lot of, these are family members who did nothing because they were afraid of what the results might turn out to be. And sadly, it was a waste because they would have been treated. They would have been still living now. Yes, yeah. They would have still be living now. But then they did nothing. So, what happened already happened. But nevertheless, it's something that we can learn from. Try to also ask questions with with some people that might have similar cases. Try to ask them what their experiences are, so you get to learn from them. Don't be afraid to confront your predicament right now. But just have faith; it will come to pass. You just have to take action. That is the first step. Okay. So another one is just try to be positive. No, of course we only have a limited amount of time here in this world. So if you keep on be depressed, right? It would also be a waste because there's, even with cancer, there's still a lot of things in life that you can be enjoying. Even with this pandemic, even with this pandemic, there's still a lot of things in life to be grateful for. Okay, so find those things, count your blessings. Okay, so even if yes, you were diagnosed with cancer or you are suspecting that you have cancer, yes, it seems that all the burden of the world is on your shoulders right now. You are a single mom, you're providing for your children who are still very young, and you're the breadwinner and you were diagnosed with cancer. Even if the burden is too much, try to count your blessings. It will really lift a lot from your shoulders, because then you will be more positive in approaching life. If you are diagnosed with cancer right now, for the next few months or the next few years, it would be all cancer. Do not forget to live your life as well. Okay? Enjoy the things that you have right now.
Wow, what wonderful, encouraging closing statements. I really like the one that to take action. Take action, because today breast cancer is something you can treat well. And today we discuss a new angle many of you probably never heard before, which is prevent the reoccurrence of breast cancer. Because many doctors are confident to defeat cancer the first time. All right, it's the recurrence that we've got to stop. And Dr. Jansen shared the strategies. So thank you very much, Dr. Jansen. Again, if you feel lumps or anything, Dr. Jansen is not only a lifestyle medicine doctor, he's also a family doctor. So he can also be that first step, right, Doc?
Yeah.
You can go
and work in primary care.
Yeah, he also works in primary care. So he can be the first step to also refer you to any good general surgeons if you need to. All right. So thank you very much, Dr. Jansen.
Yeah, thank you for having me.
Okay, we look forward to having you again and again and again.
Yeah, sure.
Bye-bye.
Bye.
Hi everyone! For those of you who just came in, you are watching another episode of Simply Nature webinar. And we are now in the what we call AMA or Ask Me Anything portion. But just before we go to our questions, let us first greet our viewers for tonight. Okay, starting up with, of course, our Miss Jeanette Koo from Child House, Manila. Also, Miss Cecilia Abayan Lopez. Hello, good evening po. Louis de la Cruz, Zenaida Maranga, Nelia de Iro. Welcome, welcome. Wen Carino, Ani Yang Yang, Joy Cabrera, Fatin Semarina. Okay, and we also have Imelda Oracion, Flordelina Doropan. Wow, Cheche Stellan. There you go. Well, thank you so much for watching our webinar for tonight. So I am very sure that you have learned so much from the discussion that we had earlier. So let's not keep you waiting because I can see a lot of questions are coming in. And now to answer our questions in this modern world filled with noise of different health opinions, let's trust the ones from the experts. Let's call on once again, Mr. Shyan Lim to answer all our questions for tonight. There you go.
Hi, everyone. Hi, Sheila.
Hi, sir. Good evening. All the way from
Good
Taiwan.
evening.
Wow. How are you, sir? And how's the weather there?
The weather in Taiwan is very hot, just like Philippines. All right. So it's a great time here. I'm just so happy that we told ourselves, me and Doc Jansen, we will not miss our weekly program for anything. So I'm very glad to be able to answer everybody's questions tonight. So Sheila, let's go jumping. And for everyone's knowledge, okay, Dr. Jansen is currently finishing up his TCM class for tonight, and he will join us in a few minutes' time. So again, it's really great that Doc Jansen is picking up TCM, so you can see as a group, as your two hosts for this program, we are beefing up our knowledge base so that we can give you a complete approach, whether it's TCM, whether it's conventional medicine, whether it's about supplementation. So Sheila, let's go.
All right. So first off, on our first question for tonight, coming from Ms. Louis de la Cruz, what is the minimum age that can take PPARS just for prevention? If PPARS tablet, how many can be taken? Very
Okay,
good question.
for prevention of cancer. So let me give you the short answer first. We have infants taking PPARS. All right. So Dr. Jansen's youngest patient is little Jhen. If I'm not wrong, little Jhen is less than a year old. All right. I believe she's only a few months old. And correct me if I'm wrong, Sheila, right? Do you remember?
She started taking PPARS before she had her first birthday. Yes.
Yeah, before she had her first birthday. So, okay, there you go. My niece and nephews have been taking PPAR tablets as a basic supplement. For my niece, since she was 4 years old, and today she is 17. And my nephew was actually younger. He was about 3 years old. Okay, so it's great for children. My niece had a growth on her lip. My sister didn't want to have it cut by the pediatrician because of the general anesthesia that she had to be under. So she decided to take PPAR tablets, and within a month, the growth actually went down on its own. So again, PPARS is really great in the sense that it boosts your immune system, and I can answer in specific how, but ask me if you need to. If not, I won't go too much detail. All right. So yeah, you can start at any age. It's safe for everyone to take. Now, in terms of prevention, so here I want to elaborate a little bit. How do you prevent cancer, right? That's a big question. There's no such thing as an specific anti-cancer supplement. So I want you to have a better understanding so that you can choose what to do better, all right? If anyone comes up to you and says, hey, take this so that you are anti-cancer, that suggestion or even that answer is somewhat correct and wrong at the same time. There is no magic supplement or pill or anything that will stop a specific cancer, right? So how do you actually prevent cancer then? You prevent cancer by managing the things that cause cancer. or promotes the growth of cancer. So number one, control your chronic inflammations. Okay, so if you have inflammation in your body, what happens is that you make your body very conducive to cancer to grow, for cancer to grow. Next, keep your immune system healthy. Why is that important? Every day, even healthy people like myself, Sheila, who are cancer-free, and I hope for many viewers who are cancer-free, our body produces cancerous cells as part and parcel of even breathing in and out and metabolizing your food that you take, repairing cells, replicating cells. There are always cancer cells being. Our own immune system goes and scans all these cells in our body and removes and kills wrong cells every day, all the time. So then how do we develop cancer? We develop cancer when these wrong cells are not detected by the immune system. And over time, they accumulate and grow into a gang. And then after a certain amount of time, usually it takes years, it grows to a point where it becomes a tumor. The tumor may or may not be benign or malignant, but if it's malignant, it's cancer. Okay, so anything that strengthens your immune system to get rid of wrong cells in your body will, in a sense, keep you or prevent cancer. Okay, now metabolic syndromes, things like diabetes, high blood cholesterol, they are direct factors that affect your chances of developing cancer, especially diabetes. So if you manage your metabolic syndromes like blood sugar, blood cholesterol, you are in fact taking steps to make yourself anti-cancer. Okay, so that's your cancer prevention. So of course you can do things like stop smoking, stop drinking alcohol. That will help you prevent cancer. Now let's go back and answer the question directly. You want to take a supplement that helps you prevent cancer. So from what I explained to you, you want a supplement to do a few things. Number one, help you manage your metabolic syndromes, help you keep your blood sugar management good, help your blood cholesterol, help keep your blood cholesterol down, right? You want a supplement that manages your chronic inflammation. So in general, people will say antioxidants, right? That is also true. However, there are important concepts like modulating your inflammatory response, okay? So that's what PPARS actually does, okay? So manage your inflammation. Next, you want a supplement that actually keeps your immune system working and keeps it working well. So these are the specific things that PPARS, even the tablets, does for you. So it's anti-cancer. It's anti-cancer because it manages inflammation. It's anti-cancer because it keeps your immune system working. Again, I can go into great detail, but I just want to answer the question. It keeps you anti-cancer because all these comorbidities that cause you to develop cancer, like diabetes, blood sugar, blood cholesterol, the PPAR protocols manages all that. So in that sense, that's why PPAR tablets are the best ways to take as a cancer-free person to actually prevent you from developing cancer. There are other supplements like turmeric. These are also very effective because they manage similar mechanisms, and that helps you keep yourself cancer-free. So if you have genes, if you have cancer genes in your family, then you want to watch all these things, the inflammation, the metabolic syndromes, so on and so forth, and keeping your immune system active. Okay, so I hope I answer your questions clearly. Okay.
Very well said. Actually, sir, it's a valid question. I'm sure that our patients out there are very much concerned not for their families not to get the same diagnosis. That's why
Yes,
they ask the question.
absolutely.
All right, thank you, sir. Next question coming from Ms. Hazel Guerrero. What if I have breast cancer with bone metastasis? Do I still have a chance to survive if I take PPARS, like no chemo?
Okay, that's a sensitive question. Okay, number one, go for a consult because number one, your cancer is in metastasis, so immediately it's stage 3, stage 4. Okay, so that's a late stage cancer. I don't want to give you an irresponsible answer by just giving you a straight answer. So number one, go and have a consult. So I would recommend Dr. Jansen for a few reasons. Number one, Dr. Jansen will use not only PPAR protocols, he uses other integrative protocols as well. And he's very, very familiar with all the oncological protocols, which means your chemotherapy, your immunotherapy. So if you choose to finally go back to chemotherapy or immunotherapy, then Dr. Jansen will be able to match your, how shall we say, your supplements and everything to complement it. Also, for breast cancer, there are many therapies like targeted therapy, immunotherapies, which are affordable, all right, and chemotherapy that is very effective. Because breast cancer is so common, there's so many people with breast cancer that the pharmaceutical industry has been developing and improving their drugs. So the chemotherapy, the immunotherapy, the targeted therapy that people were using 20 years ago, 10 years ago is very different from the ones now. They've improved it a lot. So don't be so afraid about exploring chemotherapy, especially since you are late stage cancer. Now, if you're worried about side effects of chemotherapy, this is where Simply Nature PPAR protocols can actually mitigate. We were talking about it at our headquarters here in Taiwan just a few hours ago. It really removes or manages all the side effects, and you won't damage your healthy organs, or we will better be able to reduce any damage to your healthy organs when you take the PPAR protocol, especially the liquid, together with your chemotherapy. Okay. So let me answer your original question. Can PPARS read it again, Sheila, because I talked so much, just in case then someone popped in. Yeah.
Right, let's just read it again. Okay. But the question is it okay for her to just take PPARS without chemotherapy, even though there's already bone metastasis?
Okay, PPARS will for sure help you. Now, if you just take PPARS alone, will it be sufficient? I think you want to take every available option. For example, if you're not suitable for your chemotherapy, then PPARS alone would be your best option. Do we have patients who recovered well and go into remission and have their tumor size reduced during metastasis with breast cancer breast cancer metastasized to the bone? Yes, we have patients that have done well, all right, and are in remission. However, we must know what are the other conditions. Okay, are you changing your lifestyle as well? Are you taking any other supplements? Are you using other protocols together with it? Yes, you have a consult with Dr. Jansen, so we can give you a proper answer. All right. However, right now, before your first appointment with Dr. Jansen, you can straight away go on to the PPAR liquid or the PPAR extract powder protocol cancer metastasized to the bone. So time is not your friend. So you want to act immediately. So while arranging for an appointment with Dr. Jansen to find out exactly what your strategy cancer will be and what your history supplementation to start that natural process. Okay. So the answer is yes, possible, but please explore all options. Okay, don't just go natural because natural. Go for the best.
Consult with Dr. Jansen. The link the link for you to have a consult is on the description box, or just type in how to consult. Same goes with Miss Cheche's Ciela, because she's asking how to go for a consult.
Let me try and remember. She had a cancer that was metastasized. Therapy will very likely harm the baby, right? Because you're injecting chemotherapy into your body, our powder. So that kept cancer at bay, right? And the tumors stopped growing. I think it even shrank a little bit, okay? And then she was able to successfully give birth, right? After she gave birth, she could then use all the other, should be about 4 years old today now, because this happened before the pandemic. So
I know this patient, she is actually on her first trimester.
okay. So number one, how's the pregnancy? Is there any issues? Because one of the challenges today, okay, is ladies who have difficulty getting pregnant. So if you had no difficulty getting pregnant, then go ahead, no problem. Now, why did I bring it up? Because there are some ladies miscarriage during the first trimester. And the reason is because they have a hostile immune system that targets the embryo. The baby actually connects, the embryo actually connects with the mom. So it's now part of the mom's body. But during the first trimester, the embryo is just attached to the side of your womb, right? So it's still considered, can still be considered a foreign organism. So during this time, some ladies have very hostile immune systems, and their own immune system actually attacks their embryo. So for these ladies to get pregnant and to stay pregnant during your first trimester, they are actually taking medication to weaken their immune system so that the immune system doesn't act upon the embryo. Okay, so if that's your unique, if that's the category that you're in, then you might want to wait until your first trimester is over before you go on the PPAR protocol. But if you are not in that case, then there should be no issue. And in fact, all pregnant lady, we always encourage, we do actually encourage pregnant ladies who are past their first trimester to be on the PPAR tablets all the way until giving birth. Okay, the reason is nucleic acids and other great things that help your baby develop and help your baby develop very healthily. And for ladies who have normal pregnancies, even during your first trimester, they take the tablets. It's great for the fetus, it's great for the mom, specifying a specific unique condition. So again, I hope I've answered your question directly. Sheila, did I miss out anything? So the answer is yes.
Actually, yes. On it because there's like a factor of weighing in things. Should I go for the treatment without the conventional thing? It's a very valid question.
If you have, if let's say your oncologist is saying you have to go for your chemotherapy, you know, your cancer is serious, is fast, then definitely you can't not go for chemotherapy, or you can't do nothing, right? Then at that case, in that sense, no matter what, go on a PPAR protocols already, because that will protect your body, and that will also, and if your body is protected, your body will do its best to also protect your fetus, your baby that's developing, right? Or if you cannot do chemotherapy and the cancer is growing, then you have to do something, right? So that something would be the PPAR protocols. If you're not sure, have a consult with Dr. Jansen.
Exactly. Thank you, Sir Sean. Okay, another question coming from Ms. Marciana de la Rosa, which I hope she was able to elaborate more. How many PPARs should I take before I see the effect, or before I get healed or cured?
Okay, what is the illness?
Exactly. She did
Okay,
not
I
answer.
assume, okay, I'm gonna assume since tonight's program is about breast
Yes,
cancer,
yes.
so the question is, the illness is probably cancer, okay? Now,
Mhm.
depends on the seriousness of your cancer, but if let's say you're third, fourth stage cancer patient, you're feeling weak already and everything, you know, you can feel the effects of PPAR liquid as fast as within the first 48 hours. You feel stronger, you feel better, okay? Now that doesn't mean that your cancer tumors are shrinking. Okay? That means that number one, the PPAR liquid extract will, number one, first of all, strengthen your body. Now, that's very important, because once your body is strengthened, your immune system is also strengthened specifically in that process. It also makes your body, if your body is healthy, it means that if you have to go for surgery, you're in the right condition to go for. If you have to go for radiotherapy health, it means that the other options for cancer treatment become readily available to you, and that you can use any one of them depending on whether you want to or not. Okay. Now, with regards to fighting the cancer itself, you should be able to see results within a month. Okay. What do I mean by results? You will see whether, okay, the tumor has stopped growing, so it's the same size, or the tumor was growing very quickly, now it's growing very slowly, so you can see that your condition is improving. Or it could be so good that the tumor shrinks. Okay, how come I cannot give you a definite answer? Because I don't know the actual condition of your cancer right now. And also, our PPAR protocol works on your immune system. It doesn't work on the cancer right now. That will affect health effects, especially if you're taking PPAR liquid as fast as 48 hours. Feeling stronger, feeling better. Yeah, pain is also affected. It should be improved. So that could be felt very quickly, but the result on your cancer, that will take some time. It could be as fast as a few weeks. It could take a longer time. So imagine, I want you to also understand what's going to happen, right? You have cancer and your cancer tumor is growing. So it's like a car going down the road. Now you suddenly want to turn around to almost a full stop and then make a U-turn and then go back the opposite direction. So it's the same for your cancer tumor. You have to tumor until it stops growing and shrinking it, right? So while you take the PPAR protocol, how fast your cancer growth slows down from growing quickly to growing slowly to stop growing and then start shrinking. That speed depends on many other factors. It can be as fast as a few weeks. It could, right? Maybe 3 months. So at every point, if you are even at any doubt, you can always come back to this program, give us your details, ask questions, right? Or you can directly message Ciela and Jhen. And if you need a consult, we can always help you arrange a consult with any of our doctors like Dr. Jansen. Is this helpful to everyone? Am I going too much detail? Okay, yeah.
Also tackled about strengthening the body at the onset of taking PPARS, because we have a lot of clients also who cannot pursue or continue their treatment in their hospitals because their immune system got weakened. So when they take PPARS, yeah.
No, you're absolutely right. Yeah. Today, even here in Taiwan, I was just talking to people at our factory, and they were just sharing Taiwanese clients, right? Once they go on chemotherapy, they feel so bad and they can't continue. Then they start taking the PPAR liquid extract. They feel stronger again and they can go back onto their chemotherapy and their side effects are managed, so they can carry on with their cancer treatment together with the PPAR liquid. So there you go.
Exactly. Coming from Mr. Louis de la Cruz. So a while ago, it was no chemotherapy. This time, can it cure breast cancer without having to undergo surgery? What PPAR should be taken?
Okay, depends on your stage of your cancer. If it's stage 1, stage 2, you can try. Okay, so whether it will be successful just on PPARS alone, okay, then I would say it would depend on your body condition. All right, so the answer is yes. Okay, now when it comes to surgery today, if you're early stage cancer, the surgery is minimal and they can be very specific. So it's not like you have to have a mastectomy where you cut out your whole breast. It's very targeted, just that small tumor alone. Okay, for that, we will recommend you to Dr. Jimmy Katapia, one of the top surgeons in Medical City, Manila Medical City. And he's actually the head of the cancer center there, if I'm not wrong. All right. Last year when I talked to him, he was the head of the cancer center over there, right? So he will be able to help you with regards to that. Now, where does surgery stand in terms of cancer treatment? So operated on, surgery is like the most effective way to get rid of the cancer because you just cut it out. Okay. Now, surgery is not an available option all the time. So when the cancer is operable, surgery becomes, if you ask Dr. Jansen, if you ask Dr. Jimmy, for most cases, the surgery will be one of the best options, right? But there are cases where Dr. Jimmy, the surgeon himself, would tell you, no, don't do the surgery. Use other protocols. Yes, it's possible, but again, don't eliminate the options of surgery because surgery is one of the most effective ways to treat cancers that can be operated on.
Thank you, sir. Okay. We wants to reiterate, okay, your answer because the question once again is, can I take PPARS powder during first trimester of pregnancy?
Again, the answer is yes, if your pregnancy is normal and not, in fact, it's good. In fact, it's good. So I just want to give you the confidence. One, that there is only one condition in the trimester that we will say, okay, let's wait until the second trimester. Again, so let me share with you exactly what is that one category, right? It's when you already have difficulty getting pregnant because you have a hostile womb. Your womb actually attacks the embryo, which is during the first trimester. Okay, why? Because in the first trimester, your baby is still not recognized as part of your body. It's attached to the side of your womb, but it's not connected to you. Okay, so it's still like a foreign organism. Okay, during this time, by right, all mothers when they get pregnant, there should be a switch in their immune system to help them recognize the embryo. But don't know why in the last 10 years, there are more and more occurrences. That's why it's getting hard for even young people to get pregnant, because the incidence of hostile wombs are becoming more and more common. So for these with injections that lower their immune system, they also have other treatments, like for example, they'll take the blood from the father, and then they will process it and then inject it into the mother, so that the mother will then recognize the DNA of the dad, so lower the chances of the immune system attacking the embryo. Okay, but if that is not your case, if you didn't have to go for all those treatments, if all your treatments, all your checks with the OB-GYN are fine, then yeah, you need to manage your cancer. Okay, if you don't have cancer, all right, and you're just asking the question, should you during the first trimester? I will tell you, if you're not sure about your body, then wait until your second trimester. But the answer is absolutely yes. Second and third trimester, it's really good for the mom and the baby.
There you go.
Those are very specific, because you need to tell me more details for me to give you a very specific answer. But I think I already talked in that, where yeah, we will not encourage, which is a mom with a hostile womb, and you're trying to wait until the baby stabilizes. That's why the first trimester is the most sensitive trimester.
Correct. Okay. Well, thank you, sir. Another question. This question is thrown to us private. Can PPARS cure or manage sciatica?
Sorry, I was reading a question. Sorry, can you repeat that again?
One more time. Can PPARS cure or manage sciatica? Sciatica. Yeah, go ahead.
How do you spell that?
Oh, it's SCIATICA.
Medications to starve the cancer cells of nutrients. Yeah. So that's how I would approach your case. But the things that I suggested, it is still better to protocol. So whatever the onco recommends, no, that's what I partner with. Okay, so that's how I would approach your case. But definitely you would have to undergo further treatment, because yeah, there are new lumps that occurred. And since there is already a lump on the left breast, I would suggest a whole body PET CT scan, no, to check if there are any other areas inside your body that was affected, okay, or that has a problem or whatnot. Okay, so yeah, that's what I would suggest for your case.
Okay, thank you, Dr. Jansen. Another question coming from Ms. Carino. A while ago, the case was breast cancer. Now, this time, I think it's different because she mentioned brachytherapy. Now, good evening po. If I have already finished chemorad and brachytherapy, but then the nodule still take another round of chemotherapy?
Depends. You have to go for a consult to answer it. Go for a consult, follow up with your onco, then also set an appointment with me, so I can give a better assessment. I can have a better assessment, so I can give you a better recommendation.
You know, I want to take the opportunity because, you know, we actually answer general questions. So please understand, everything that we share is not really specific for you. It is it's an answer to basically what would be the right approach, where every person should be given specific to you. So there needs to be a more, we want to, when we answer you on this program, we're giving you the information for you to understand mechanisms and to move to the next stage of your decision-making process. So always, you know, feel free, and we definitely will encourage you to ask more questions to understand. And then after that, you important to know that you have to have a yeah. So that's why Dr. Jansen asked you to go for a consult, okay? It's not that he doesn't want to answer your question, all right? Because, yeah, okay, so this is cancer. This is not a flu, okay? So we definitely want to be very, very specific and careful.
Yes. But nevertheless, we would want to say thank you for your questions because our viewers
Yes.
right now are very shy to ask questions, but they can actually relate to or the other who are asking questions.
Oh, wait, I just want to read a reply. I just want to thank Miss Glenn's Regala. She wrote, right? She wrote this on our Facebook. You guys, I mean, on the chat, you guys can read. She said, I agree with you, Sir Shyan. PPAR protocol helped my mom to strengthen her immune system together with the treatment plans of Dr. Jansen and Dr. Jimmy. So she had both Dr. Jansen and Dr. Jimmy scan showed improvement. Her cancer progression slowed down. Thanks be to God. Hallelujah. So that's again a perfect example of what we are trying to encourage here. So I know if you really want totally natural, yes, you can do it. But here we would just want you to explore the best option for you.
Excellent. Thank you, Sir Sean. Okay. Another question coming from Suzanne Mita Cayetano. I am stage 1 breast cancer, no lymph nodes seen during mastectomy. No chemo, no radiation, no medicine. Can I just take PPARS alone to prevent so that so the cancer cells won't return or won't come back?
Yes, of course, of course. So you are already in the stage of remission, and number one advice that I always tell my patients who are in remission is to live a very healthy lifestyle. So you have to eat properly, the right foods, you have to exercise, you have to sleep well, and reduce your stress, no? Manage stress properly. Okay?
Yes.
You can take PPARS. Actually, PPARS is a microalgae supplement, no? And microalgae are very good detoxifiers. Okay? It detoxes your body quite well. What entities or what substances does PPARS is good to use with, no? Heavy metals. Okay? Antioxidant properties, which will definitely help with anything inflammatory inside your body. So yes, definitely the answer is yes, but PPARS alone would be basic. You would need other medications, other supplements, so to speak, no? Depending on the metabolic profile that you have. So if you want to know more, yeah, I suggest go for consult. But if you're good with this, then yeah, just take the PPARS.
Is it enough to only take PPARS tablets for stage 0 and stage 1 cancer?
Oh,
go ahead, go ahead.
I would say you're dealing with cancer and then you're dealing with a stage 0, stage 1 cancer, which means it's the easiest cancer to defeat. Please don't go with minimum. Go with the best, because it's the highest chance of success at any period of your cancer is stage 0, stage 1. And since this is you're opting to go for natural, there is no, it's not like chemotherapy, right? You don't want to use the strongest chemotherapy when you're at stage 1, because chemotherapy, natural therapy like PPARS, there is no side effects, only even better other benefits, including making a huge impact on your chronic inflammation, on your comorbidities if you have any, right? I would say go for at least the powder, right? Yeah, and if that's really so difficult, then at least the soft gel for at least 2 months until everything is so super clear. Then you go and stay on the tablets as a general supplementation. Dr. Jansen, what about your view?
I agree with you.
Yeah,
It's day 0.
It's so good news that you managed to catch the cancer at stage 0. So at this point, do the best that you can so that there's no chance at all that it even goes any further, right?
I would actually even go one step beyond and recommend the liquid.
Yeah, I would do that
because especially if you don't really want to undergo the chemotherapy, radiation therapy, I would with. So how then would I monitor response to treatment.
Oh, that's great. That's great. Please
Yeah.
advise.
ctDNA, circulating tumor DNA. And I would
Wow.
base response to treatment on that because it's stage 0. You underwent
Good.
surgery. There's no lump to monitor. There's no lymph nodes that were affected. If we undergo the regular, will appear. Okay.
Yeah.
But of course, there has to have there has to be an end to PPARS treatment, no? Especially liquid, because
When will you stop,
cannot,
right? You want to know
yeah, when will you stop?
Yes.
Yeah, so I would first have a baseline of getting a ctDNA test, no. ctDNA is circulating tumor DNAs. It has a quantitative report. So meaning it has a number, circulating tumor DNAs. So after X number of months, then we repeat the ctDNA, then check again. So and compare, no. If it goes down, then well and good. We do it until the ctDNA is non-significant already. Okay, so that's how I would approach things. But just a disclaimer: this method is not yet out. It's not yet in the guidelines. Okay, this is just me using my experience and my in knowledge of the existing technologies, no, that we have nowadays, the more advanced ones, to see response to treatment. Okay. Yeah.
Yeah, and I also wanted to add, right? If you take, for example, PPAR liquid, you are just gonna have other benefits, right? Like you're gonna really have big impact on your chronic inflammation. It has other benefit enough. How blessed you are to have caught your cancer so early. So this is the best time to do everything possible and not to say do what is minimum. No. Okay. If you never want to ever approach chemotherapy or radiation therapy, then do everything that you can now. That's available, right? That's good. Of course, that doesn't mean you go onto the market and take every supplements that anybody say is good for anti-cancer, huh? So because there are a lot of crazy stuff out there as well. But what we are doing is proven, is being used by doctors. So yeah, there we go.
Definitely that just to reiterate, the two gentlemen tonight just don't want you to say sayang, in the end.
Yeah, because you never get stage 0 again, right? If you miss it, you miss it. All the best thing that you can do and make sure it doesn't go beyond that.
I got curious about the ctDNA. If a person wants to quality or this examination, is it like a blood extraction, and where can they go?
Yeah. I know a company who does it. The company is based in Vietnam. So they have headquarters here, an office here in the Philippines, wherein they do home service, no. They get just 10 ml of your blood. But for this specific modality, for this goal, no, of checking circulating tumor DNAs on a pre-existing breast cancer patient, then a sample is needed. So since the patient already had a surgery, the patient would have to go to the hospital to get a sample of the tumor. And that is what we submit to the company who does this test. Then the company would take the sample, the tumor sample, and 10 ml of your blood. So test that you would have to undergo. Okay, so upon getting this test, okay, the subsequent ones, you would only need 10 ml of your blood. That's it.
Interesting.
If I'm not wrong, Doc, this one is actually Gene Solutions, right? They are actually surprisingly affordable. Expanding already into Singapore. So that just because just in case, some of us might be thinking Vietnam, aren't they a third world country? You know what I mean? No. So there's countries like Vietnam, they're growing very aggressively. So there it is. So again, for this question, yeah, it's just so wonderful that you found your breast cancer, the cancer so early. Just wonderful.
Thank you, sir. Thank you, Doc. Okay, let's just answer maybe 2 more questions before we part our messages. Coming from Ms. Han Yuri, how accurate is core needle biopsy?
Depending on how the sample was taken, if the sampling was done correctly, it is accurate, really accurate. This is only the way on how we know what kind of tissue that was taken. Okay. Answer simply yes, it is really accurate. Is it the sensitivity? Yeah, the sensitivity and specific is almost 100%. Okay, so in that sense, the if it is the true positivity is very high. Okay, true positive means how do I explain true positive? When you we're getting too technical here, no? But let me just rephrase it. The chances of getting false results is low. Yeah. Okay. So that is how accurate core needle biopsy is. The only situation wherein the result would be equivocal or the biopsy result coming out is not clear is when the disease itself is not clear. Okay, it can manifest as such. No, when the sample was taken correctly. However, upon looking under the microscope, the tissue doesn't point to one direction, or yeah, the characteristics of the tissue doesn't point to one direction. So it has to be correlated clinically as well. Okay. There are situations wherein it's the case, but we seldomly experience these kinds of situations. And when we do have these kinds of biopsy results, no, we have further tests that we can do to further characterize what the sample is staining. Okay.
So basically, what Dr. Jansen, just to ask, to clarify on that. So basically, it's in good hands if she opts for core needle biopsy. Yeah, okay. I see one last question, Sheila, that I wish to tackle. It says, what's the difference for done? What's the difference with all the forms of PPARS when and the tablet? That means the different forms be taken. So I just want to clarify this. The liquid is the most beneficial, strongest, the one with the fastest and best results in general. All right. So there are specific situations where the powder will be better. It's, for example, if we're talking about kidney failure content, so that's easy on the kidneys. So that's like only one like exceptions. If not, the liquid is always better. Okay. So our policy, one of the most senior doctors that I have spoken to, this is her, I guess, her ethics. Her ethics that she always says is, I don't judge. You know, she doesn't judge. So she never judges whether a patient's, she doesn't advise a patient based on their financial capacity. There's a zero consideration to her. She starts by telling the patient the best. And then from there, then you work with the patient to find the next best option that works for their finances, right? So when we look at this perspective, then the liquid is always the best option to go for, right? So like what Dr. Johnson said about that stage 0 cancer case, the liquid is the best thing to go for. Now, if that's financially sustainable, then go for the PPAR powders, right? So usually for cancer, you will want to use the best that you can afford, right? So powder is also very, very effective. Tablets are not sufficient for cancer treatment, okay? Tablets are also not sufficient if you want to support, for example, chemotherapy side effects. You have to use extracts. Minimum is likely you want to start with a powder, and if you have any negative reactions to chemotherapy, you want to go to liquid until it stabilizes, then you go down to powder. Or sure, simply type in your questions, and either our customer service officers will help you if your questions are pretty much within the regular spectrum. If not, go for a consult with Dr. Jansen so that you will be clear about it. All right. And if you need to go for surgery, we can always refer you to our good friend Dr. Jimmy Katapet.
Exactly. There you go. All right. So, at this point, of course, just before we say goodbye to our viewers.
Sorry, Sheila. I saw this such a cute response. Han Yuri said, I only took the tablets and I felt the tremendous effect in my body. The best supplements for me. So you see, the tablets are really, really fantastic also. But again, when it comes to cancer, we always use at least the extracts. Now, if the tablets alone work so well for you, it's really a miracle. Okay, but yeah, for any other, for general health, definitely the tablets are wonderful, tremendous effects. Okay, yeah.
Couldn't agree more. All right. Okay. Once again, just before we say goodbye to our viewers, as you know, our viewers are always a mixture of those who are on prevention, on the journey, and on remission. Okay. So I'd like to ask for a very quick parting words coming from our two gentlemen. Who would like to start off?
I start first.
Okay. First one from Taiwan.
So that I don't
Okay.
have more time, I just want to say thank you again. Thank you for everyone. And I guess looking at today's attendance, breast cancer is a very hot topic and remains to be so. My last words are actually not only for the viewers but also for Dr. Jansen who joined us, because I had such a wonderful. I'm in Taiwan now, so I just spoke to Jack and we had such wonderful conversations about what's happening with cancer treatment. And I wanted to encourage Dr. Jansen also. So in Taiwan, the developments of using TCM to support chemotherapy is doing very well. So it is becoming more and more popular, more trusted and a standard procedure to use, like supplementation and specifically TCM, because obviously Taiwan is Chinese, right? TCM complementing the chemotherapy procedures and other oncological procedures. So we are all on the right track. It was a really good conversation, and